Hello, hi guys, welcome to Two Dogs Podcast. I'm Dr. Ali here.
And I'm Dr. Inky, and welcome to the podcast. And for this podcast, we're doing things a little bit different.
Yeah, so usually it's two medical doctors who don't talk about anything medical.
Yeah, but this time we are going to talk about the medical
stuff, and we decided to do 2 plus 2.
Yes, we do it. Yes.
So this week is going to be 4 dogs.
4 dogs. Yeah, the 4 dogs.
The 4 dogs.
Yeah, so Jenny named the 4 dogs podcast.
For the next 2 episodes.
Yes, that's correct.
So what's so special, Inky?
So today we'll be talking about cancer. Alright?
Like the big C.
The big C. No. The Krebs cycle. No. This is one of the major diseases which actually affects a lot of people.
Right.
And it actually breaks a lot of hearts, breaks a lot of families, and it breaks a lot of people's self-confidence as well. And today we are very honored to actually be joined by 2 of our very close friends, good friends, doctors, and as well as they are cancer survivors. Yeah, cancer survivors. Alright, so come, let's introduce.
Then again, one of them is a recurring
one.
So for those of you who missed episode 100,
go ahead and click back
episode 100 and you know who we're talking about, and I'm going to introduce her again.
Yes.
So, without further ado, Aisha, introduce yourself.
Hi, my name is Aisha. Second time here. Thank you, Dr. Ali, and thank you, Dr. Inky, for inviting me for the second time. My name is Dr. Aisha. I'm a 2-time cancer survivor. I'm a medical doctor and also a businesswoman. I started Dr. Aisha Medical Fitness.
So what do you do professionally?
Professionally, I help people to regain their health and their fitness through a medical fitness program.
You do other things also, right?
Yes, I'm a bodybuilder.
Thank you.
She is an award-winning.
How many times? 2 times? 1 time?
Oh, I recently just won NABA Universe, third in the universe.
Third in the universe, not in the world, okay? Third in the
universe, including all the planets.
Yeah, take that, Martians.
Exactly.
Right, so with us we have a second guest today, and this is her first appearance. Right, so let's welcome Dr. Emilia. Dr. Emilia, give us a brief introduction of yourself.
Hello everyone, it's my first time here joining Dr. Ali, Dr. Inky and Dr. Aisha on this podcast. I'm here because I'm also a cancer survivor. And anything else?
What do you do?
Yeah, what do you do professionally?
Okay, so my daily job is an aesthetic doctor, so I help people look good and look young and feel good about themselves.
How many clinics do you own now?
Currently 12.
Wow.
So going to 14.
So finally somebody beat you.
Yeah. No. I have always validated this. She has more clinics than 2 hands can count. Okay.
Yeah, you need to borrow some.
Yeah, I need to borrow some.
Soon I hear more opening up.
Opening up.
Okay. Right. So we're going to as part of our Cancer Awareness Month, which we are going to be conducting for this current month of episodes. That's why we welcome these 2 doctors who are actually cancer survivors.
Correct. So I think in this podcast and the next episode, what we want to deal with is we want to deal with the emotional aspects and the psychological aspect of a cancer survivor. And because Dr. Aisha and Dr. Emilia are cancer survivors, they are doctors as well.
So from two
different perspectives and how they navigate through their cancer journey as doctors and as patients as well. So I think the first question I will ask Dr. Aisha, what were your thoughts and emotions when you first received the diagnosis of cancer?
Well, during the first moment when I know I got cancer diagnosis, I would say the feeling is numb. I was practically numb, in shock, and I think it's a dream, it's a nightmare. I couldn't associate with any negative emotions at that time. And then I realized I have to think strategically. So we as doctors, it's really common for us to ditch our emotions so that we can think logically and strategically. So the first thing I asked my doctor, okay, now we confirm we have a cancer diagnosis. The next step is, what is the plan? After that, my doctor asked me to go to a mammogram to look at the features because we did mammogram after biopsy. So the cancer has been confirmed. So dia macam terbalik lah. Usually you do mammogram and then biopsy. But now we are doing biopsy first And then we went to mammogram to have a baseline picture under the imaging. And when I was in mammogram, I was still in shock and feeling numb. And in my head, I was thinking, okay, what I'm going to do, who will I tell? So all the list of things that I need to do to navigate the next journey is in my head. But when I went into the mammogram room and I found myself looking at my reflection in the mirror, that was when all the emotions hit me. It's just like snap, and I had a breakdown. And then it was a big cry, and I think I made everybody nervous. And when they went to me to comfort me, don't worry. They said, it's not cancer, just do your mammogram, and I'm sure you are young and you won't get cancer. But they did not know the real situation. It was really nice of them to comfort me at that time, but that was my emotions. And when I wiped my tears, gather myself and say a few words of affirmations in front of the mirror, like, I'm strong, we're gonna get through this together, like me and me, you know, Aisha and Aisha. So I talked to my inner self. We're gonna get through this. Now let's go and do this step one.
How old were you when you had your first diagnosis?
I was only 21 years old.
Right, so at a young age of 31, being hit with a diagnosis like having cancer, did you ever figure out that that's it for your life? You know, that's the end of the road, or do you think that, hey, it's okay, we will find this and we'll find out a way?
To be honest, as a 21 years old, I do not have any reference. And I start looking for a role model. And I Google people with a similar profile, young age, sports, involved in sports, and a little vain. So at that time, I found that Kylie Minogue matched with the profile, and at the almost similar timeline, we had cancer diagnosis. And she handled it with grace and poise. And for me to look at her showing up with her scarf, with her chemotherapy face and the steroid face, she was like riding a horse and enjoying her time off with the family. And it makes me feel like there is hope. There is someone that I can refer to as my roadmap. And my next step is to thank you, Internet. So I Google and search for cancer support in terms of blogs, association, where they focus on young survivors. That helped a lot because the insight that they give is beyond what the medical and health professionals are able to offer.
Dr. Amelia, I think perhaps maybe it might be a bit similar. Let me rephrase the question for you. When you were hit with a cancer diagnosis, I'm sure there were a lot of things that went through your mind, and there are things that people are going to say. Were there anything particular that when people say you actually don't like?
Actually, when I heard Dr. Aisha's story, I felt my story was quite different from hers. Because when she talked about her age, she was diagnosed at 20s, and I was diagnosed when I was 35, when I already have a daughter. So my focus was thinking about my daughter and all. And coming back to your question, what is it that I dislike when people try to comfort me is when they say you will be okay, you will be fine, you are young, you will get over it. They don't know. So nobody can tell what stage we are when we were first diagnosed. That's very important. So when we broke down, actually the next thing we need to do is to find out the staging. Because staging will tell us how much more life we have. Yeah, so when people like to tell us you will be fine, but they don't know our diagnosis, the exact diagnosis, because the kind of cancer that we got was triple negative breast cancer, which is the most aggressive type. Meaning people die from this cancer more than other types of cancer. So they don't know the cancer type, they don't know the staging, and they don't know how we feel, but they just try to be nice, which we appreciate. But actually, that don't help. Yeah. What we actually need is the proper plan and the real statistic and percentage.
So, if what do you wish your close family or friends would do if rather than saying, "Oh, it's okay, you beat it," what do you hope that they would say or do to comfort you, or probably you don't want them to do anything at all?
Maybe it's nice to say, whatever that you face, I will be there. No matter how long you live it with us or live it meaningfully. And that's just me. I'm not sure about others because some people they might not want to know, they might leave. But for me, I like reality. I like people telling me that this is a fact that I get cancer. Cancer can die. People can die from cancer. So face it, be positive, be strong, and live the rest of your life. It can be 20 years, it can be 50 years, it can be 5 months, it can be just 2 months. Live it with meaning.
Right. So, coming back to Dr. Aisha, as a doctor and as well as a patient first diagnosed with cancer, I'm very certain that your doctor would have given you a treatment plan. So, I would like to know from your perspective or from your thoughts as a doctor and as a patient, how do you navigate through your cancer or your cancer treatment plan? Were you 100% agreeable with what your doctors were prescribing, or do you have other ideas?
I'm very blessed because I know about the medical aspect of my treatment and the science behind it. In fact, I would like to go back beyond the treatment. How did I get my diagnosis? Is through breast self-examination, because I know the importance, and at that time I was in a surgery posting, and we had a topic about breast lumps, and I did my breast self-examination and found a lump. So if I were not a medical student, I might have neglected the lump and do not know what else to do. At that time, it was advised to do the triple assessment. So you get your biopsy, you get your physical examination and imaging. So we have certain pathway that we followed. And that, as a medical doctor/doctor, I'm able to navigate my treatment and my diagnosis. And another thing is I'm able to negotiate my treatment plan. So many people do not know, as a patient, you have to advocate for your own health. This is your life, this is your problem with the unique sets of demands. So breast cancer affects a lot of aesthetics. And as for me, a sports person, and I care about my aesthetic, this is important to me, but might not be important to other patients. So I'm able to negotiate a treatment plan that able to meet my demand. So of course, I want to have a high chance of survival, which I do not mind to get a chemotherapy plan that is a little bit harsh. But when it comes to the surgical part, I actually did doctor hunting, where I hunt several doctors, look at their profile, and there are certain things that is beyond the CV that help me attract. I feel like attracted to this, like in terms of their skill set, as well as their concern in the aesthetic department. Another important aspect is the patient and doctor. So I sit in this position where, as a cancer and a patient, and a cancer patient and a doctor, I need to know my own boundaries. So while I talk from doctor to doctor, yes, we can speak rationally. But when it comes to cancer patient, I know that I will have my own bias. So I give my trust to my doctors, but at the same time, I would like to negotiate a treatment plan that match with my profile. So, okay, may I give you an example?
Yes.
So I did some research about the treatment plan. So there are certain type, like breast conserving surgery. So breast conserving surgery branches out to many different types. And another thing is implant, mastectomy and implant, or mastectomy, bilateral mastectomy with like what we call it, where we transfer the muscle, like the dorsi.
Flaps, yeah.
Okay, so flaps. So there are so many, and it will be confusing to patients. But luckily, as a doctor, I'm able to visualize and read through all the treatment protocol. And another more advantageous thing is that we're able to know more advanced treatment. So, interestingly, someone, which is my breast surgeon at that time, brought my case to an international conference as a case report and case study. So, all the experts around the world, they're actually discussing my specific case to see what is the best treatment plan. I'm happy that I'm able to do the right thing, and at the same time, I'm able to navigate my health journey in a way that I find tolerable and ease my burden as a cancer patient.
Thank you. Dr. Emily, when you were diagnosed and then when you started to do your plan, how was the journey like? Did you just follow whatever that was planned by them, or as a doctor or as a patient, you did things to expedite and move fast? I think one of the biggest problems we have is health system overload in the public system. Delayed diagnosis, or delayed reporting, or long appointments. How fast or how rapid did you went from diagnosis to treatment?
Okay, so my story was I detected the lump, actually not by myself, but by a masseuse that was doing a massage on me. So when she found the lump, she told me that she found a lump. I sat up and then I felt the lump myself. The first thing I wanted to feel was whether the lump was fixed or was regular or not on the outline. And I realized actually it was partially not regular, and I felt it was mobile, but my masseuse said it was not. So we actually had some small little argument there, and then when I further examined myself, I actually realized what she said was correct. And at that point, I asked her to leave my house, and up to today, she still told me, hey, that day you chased me out of the house. Because I was already in shock. So at that time, like what you say, being a medical doctor, right, we actually have this advantage of knowing what to do, and I did not allow myself to delay any further, because the next morning itself, I wrote myself a referral letter and sent myself to do the mammogram and ultrasound on the spot. Yeah, and one more thing is that I do have direct contact number for this breast surgeon, because my mom was only diagnosed or just diagnosed breast cancer 2 years before me. Yeah, so very simple. I thought, okay, so if this was not something good, immediately I went to see the same breast surgeon to confirm. But even before that, during the ultrasound, I was already told by the imaging specialist saying that it's not good. When she put the probe on my breast and saw the lesion, she already said, sorry, I have to tell you it doesn't look good. So to me, I didn't really have to wait for biopsy, but I already started to feel the emotion, being very sad because my daughter was just 8 months old. Yeah, so I started to think about my daughter, who would take care of her. How about my business? I was just starting a new business at that time. The same week I got diagnosed. Yeah. So being a medical doctor, I think I allow the whole process to be very fast, because on the same day I did my ultrasound mammogram, saw the breast surgeon, arranged for biopsy in 3 days, and then had my staging scans in 7 days, and diagnosis was confirmed right after that, and started my chemo on day 11. So my advice is, if anybody finds anything unusual on the body, any lumps especially, be fast, be quick. So nowadays, if I have any friends or colleagues that have found something on the body, I would tell them to do any test on the same day.
I think this question I want to ask both Dr. Emilia and Dr. Aisha, because there are some patients, probably when they first get the diagnosis, they want to seek a second opinion. Is it advisable for them to seek a second opinion, or should they start on their cancer treatment as soon as possible?
So in terms of cancer treatment, there is a sense of urgency. So we want to get the diagnosis as quick as possible. If it's malignant, we want to get rid of the cancer as quick as possible. So in my case, when I had my cancer, I do not go for hunting. So meaning the surgical aspect need to be done fast. But I understand depends on your staging. If your staging is pretty early, like for me as a triple negative breast cancer patient, let's say if I wait for my treatment, surgical treatment, it will be quite risky because the nature of the triple negative breast cancer is aggressive. So the longer I wait, the higher chances for it to be metastasized. So do not wait. Get rid of the cancer as quick as you can. And then for the chemotherapy, radiotherapy will be according to the plan. You can see other doctors for the treatment. And another aspect, if let's say you need a treatment plan in terms of surgery that involve aesthetic thing. If someone who are like young patient and they opt for mastectomy, you can delay it, like in the future, maybe you want to consider doing an implant. So please tell the doctor in advance so that they can leave some skin behind, you know. So if it's completely flat, then there's no place to put the implant already. So this is something doctor need to highlight because cancer is a story. Cancer patient has a story and their life is evolving. So maybe today, I do not want implant, but maybe how about tomorrow, you know? And let's say you are doing mastectomy and then maybe you want to have like the flap. So bear in mind, people who want to do activity like sports, like bodybuilding. So it's not possible, you know, to take latissimus dorsi and take it to use it as a flap because it will affect your balance, symmetry. So there's a lot of pros and cons, and this is beyond textbook. So that's why I really advocate patients to really make sure that they know what they want, what they can accept, and what they can't accept. But at the same time, do not delay your treatment. The longer you wait, the higher chances for it to metastasize. So this is the most important thing, especially when you are young. Young individuals have higher rates of getting an aggressive type of breast cancer. So both of us are triple negative breast cancer. And when I went through all the research paper at that time, which is not recent, the statistic on our longevity is pretty gloom. Yeah, so I'm happy that I did the right thing. So I'm here right now because I did the right thing in the beginning and I had an amazing doctors who helped me throughout my journey as a cancer patient. So thank you to all my doctors.
Dr. Amelia, do you share the same opinion or do you have anything else to add?
I think being a doctor, we can answer easily that we don't need second opinion because we already know what's happening. But it's very normal for laymen or normal people to want to seek for second opinion. For me, I think it's okay, provided the time taken will be very short. For example, my case, I sought for 4 opinions, not for my diagnosis, but for my chemotherapy plan, because triple negative has got a lot of advancement medically and got new plans out there. So I think the take-home message is, like what Dr. Aisha said, I strongly agree. Do not wait for the treatment plan to start. Can start first, then only ask for more opinion for further other treatment plans. For my case, I actually spent like 1-2 days to complete my 4 opinions from different doctors. Even I did a Zoom with a professor from Singapore to discuss about my plan. So it can happen in very short time if we know what to do.
I think that's the advantage of the timeline difference. Mm-hmm. Dr. Aisha was diagnosed when she was 21, so that was a long time ago. Yeah. Whereas Dr. Amelia, in more recent times, there's the advantage of internet with more information, more research, and the ability to actually seek consultation online.
Yeah.
You can see face to face. You can talk. Before that, it's a phone call, and
before that you have to queue up.
You have
Yeah.
to be there in person.
And the queue itself will kill you.
Yeah.
You know, whereas now it's as good as it's borderless.
Correct.
You could have picked a doctor in the US, Australia, or anywhere that you choose from. Right.
Correct.
I think we're going to wrap up this week's episode, which is basically talking about cancer survival of two doctors, not us, but the other two doctors.
Yeah, two doctors and how they felt.
How they felt, the emotion aspect
that
of
is felt when they were first diagnosed, and the article message is
Don't
you
delay.
don't delay your treatment.
Don't
You know,
delay,
do it
don't-
as quick as possible. ASAP.
Yeah, or at least have one fixed plan, and the rest you can go and consult in between. My final question, I'll shoot to Dr. Aisha first. Because this the nature of your cancer is a breast cancer, when you were diagnosed with it, did any point of time you felt like you were less of a woman?
Definitely, because it makes me feel less feminine. Breast is a feminine organ. So at a young age, when I was 21, and I was given this option of you want to get rid of your breast and increase your chance of survival, or you want to take a chance and just do chemo and everything. But of course, it's not a good option. So I think this is very, very important for me to highlight about the condition that I was diagnosed later on, which is a PTSD. So I developed post-traumatic stress disorder, and to be honest, I find that this diagnosis is embarrassing. I feel embarrassed to have a PTSD because I like to be in control of my emotion. I want to be able to regulate my emotions and know and to be calm, composed with all the bad situations that happen in my life. But the thing about PTSD, as I learned as having this mental issue is that it is beyond your conscious level. So you can't control it. It's your nervous system feeling threatened in order to protect you. But at the same time, it is so debilitating that in not being able to see the reality because of this survival mechanism. So I was shocked to find out that I have PTSD because it developed so much later. The thing is, I do not understand about depression. So I had cancer 2 times and I developed so many health issues along the way, and I do not develop depression and anxiety. But only later on, when I had my triggers and I had something inside my nervous system where I feel that the way I respond to things is amplified. So I have to have a change of direction in my life, and I have to build my career in a way that it matched with my the evolution of my story as a cancer patient. So one thing I would like to highlight here is I want all the doctors out there to understand that mental issues is almost some form of anxiety, depression is common among cancer patients, and they need to address the elephant in the room. So we can't just speak to the patient like about the treatment plan, all the textbooks, because we are human and we have emotions and we have all these worries and fears, and sometimes it can be beyond rational and people do not understand. So we have problem in terms of relationships, be it among our family members and friends. This is a tricky thing to navigate, not just me, not just my caregivers, because there's something that is a different language, you see. People do not know how to talk to you, and you do not know how to express yourself because you don't even know what's going on. I invested in a therapy session, so I did a hypnotherapy, and I did counseling and also a psychoanalysis to help with my trauma. And I believe that is the most expensive investment after after my surgical expenses, and it is worth every penny.
I think that's something that's not always addressed.
I would like to highlight one more thing.
Sure.
So sorry, I talk a lot. one
That's why we
thing
like you.
I would like to give an insight how it is, how the reality as a cancer patient, especially when you are a woman and young. The feeling of your body betrayed you. So you feel betrayed all the time. And we have this thing called fear of abandonment because, okay, along the way, there were people who close to us will abandon us because of our situation, okay? And this is quite difficult because we did not sign up for this. But at the same time, our caregivers or our close one also do not sign up for this, but they can have this avoidance tactic towards you. But for you, you can't avoid the situation, and you have to develop your own strategy, your own armies. So when I had my first cancer, I remember that I started to think of this as a battle. So we are going into a battle and we need to have our army. So who are my army? So I took a piece of paper and I wrote down who are my armies. So someone who is trustworthy, who are reliable, who will not abandon me during tough times. Okay. And frustrations, disappointment is part of life. And cancer, as a cancer patient, this is something that is common, is a theme in my story. And worst scenario is that I developed strong friendship and strong bond with other cancer survivors. And along the way, they are no longer here. So it's heartbreaking because they are really beautiful people, and I believe that it is a blessing and also a curse because I get to know many special people. At the same time, it's a curse because you are constantly dealing with grief. So sorry. And as we speak now, I have my best friend. She is battling stage 4 cancer, and she is very strong. And I suddenly thought of her. So that is why mental health is important, and for me to take care of my mental health is my number one priority. In every decision that I make in my life, I make sure really to compromise with my mental health. Yeah, that's my story.
First time we're actually speechless. You know?
So sorry, I cried.
No, it's okay. It's alright. It's alright. It's okay.
Bottom line.
Okay, so bottom line, I would say a message to all doctors out there. All right, you're human. Everyone's human, and if you're a doctor and you are diagnosing a patient, you are not just diagnosing a condition. You're diagnosing a person.
Yes.
So there's a lot of things that you need to think along the way, especially their psychological welfare.
I think that would be utmost importance.
Yeah,
because it's not just the diagnosis itself; it's the point of breaking. And in fact, even if someone has already so-called been
in remission,
there's still emotions.
Yes, that's right.
There'll always be emotions. So I don't know, if I put myself as a GP once upon a time, if my patient came back and they're cancer free, I think me jumping for joy, hey, you're cancer free for 5 years, well done, high five, also seems a little bit inappropriate in a way.
Yeah.
Because they still live with that for the rest of their life. Whereas we as a doctor sit here and we don't know anything at all, unless we were part of, we had a cancer diagnosis also.
So we will continue the next episode next week. Right, come back next week as we speak again with Dr. Aisha and Dr. Emilia regarding their journey through cancer and how they battle cancer.
But we're going to turn it around.
Yeah, correct.
That'll be the fun part.
Yeah, so join us next week.